Hello and welcome. First of all, I must apologise for not putting a video out last week. I've had a few things around the home with a couple of leaks in the roof, a massive damp patch on the dining room wall to find the gutter has been leaking. And as I was trimming back foliage and clematis, I cut through the internet cable that had only just been put in probably about a month or two ago. So that was not good. That took me offline for a couple of days, so I do apologise for being late. And my video I did yesterday, I cannot get it to get online for some reason, so I thought I'd re-record in case it's the actual quality of the recording itself. I did that one on my phone, so I'm using a camera today. Bit of background info. So my name is Sam, for those of you who haven't seen me before. I'm a nutritional therapist, and my aim is to help women in their mid-years get through the perimenopause, the menopause, and into their older years as easily and painlessly as possible. So I want to share simple things that you can do, and little bits of information, but not too much, because there are others out there who give really in-depth detail. So I do want to share a bit on some information today, and I've been speaking about bone health for the last few weeks. We've talked about nutrition and exercise, and today I want to talk about testing, supplements and medication. Only very brief, because we're heading into the world of the doctor's world, your GP's world and your specialist world. So I am not a doctor, I'm a nutritional therapist, so I will be speaking from things that I have learned and read and information I've gleaned for personal interest as much as anything, because it's the one thing I think I need to focus on myself, because you don't really know what your bone health is like unless you break a bone. So we'll start off with testing. A DEXA scan is something that most people are aware of, and it's a low-dose X-ray, so a little bit of radiation. You get it through your doctor in general, and it gives you an indication of your bone density. And I believe it takes between 10 and 30 minutes. I've not had one myself, but roughly that long. And it gives you a rating, a T-score, and your score is based on a young person's bones, so it's a comparison. And minus one SD is normal. Minus 1 to minus 2.5 is considered to be mildly an indication of bone loss. And then beyond that, minus 2.5 and lower indicates osteoporosis. So that's one thing. And I believe in the UK, in general, you need to go through your GP or to a private hospital to get that scan. I don't think it's available otherwise. I'm not 100% sure though, but I think it's always good if you've got considerations about broken a bone, go and see a doctor and have a chat about this. Then I came across another one called REMS, and this is new to me, and I thought this is something that's quite interesting. It's an ultrasound-based system, and it's called, I'm going to look at this, radio frequency echographic multispectrometry. That's what it stands for, and it's a scan, an ultrasound type scan. So it's non-invasive, there's no radiation, so you could say from that perspective it's probably safer than a DEXA. And it assesses the bone density and the microarchitecture of the bone, so how it's actually functioning together, how it's formed. Again, you can get some T-scores here. So it's bone density and the toughness, basically, and again, it's lumbar and spine. I don't know whether I said that with the DEXA, it also tends to be that sort of region, the hip and the spine area. But you can also get wrist and heel, I think with both, but it's not the common practice. Now, the thing about REMS, it's not yet recognised as a diagnostic tool by the NHS. It possibly will be in time to come, but these things take time to be adopted. But it's not currently a diagnostic tool for the NHS. So it's not something perhaps they would offer at this stage. Now, I looked into this and I found a place near me, just up the road actually, probably, I don't know how far it is, 10 miles, if that. It's about a 10-minute drive up a dual carriageway, so not far. And they offer this, so I want to book myself in. It comes in at around £100. It's about 45 minutes. And if I'm able, I'd like to get myself booked in and film my experience and share that with you at a future date. So there's two of the scans I've come across. Now, you can also be tested for vitamins and minerals, and we know that we've got vitamin D, vitamin K, calcium, silicon, magnesium, manganese, zinc, boron, potassium. These are all vitamins and minerals that are related to bone health. Now, looking at these, vitamin D I think is worth testing, because it's related to so many different things in our bodily functions, and it is actually a hormone that we produce in our body at the end of the day rather than a vitamin. But we know that low levels are related to low bone density. We need it to help us deposit calcium into the bones and to absorb the calcium, and then vitamin K2 helps us deposit it into the bones. So it's something I think is worth testing, because our immune system is also related very closely to vitamin D. So if we've got low levels of vitamin D, our immune system may not be working as well as it could. So for bone health, I think that's worth testing. That comes in at around about, I looked it up at Medichecks in the UK, who do testing for the public, and that comes in at £39. Now, Better You, which is a supplement company, also offer a test. I believe they still do. That was a few years ago. It was about £32, so it'd say between the £30 and £40 mark. And then Birmingham City Hospital, City Essays, I think they come under now, if they still offer this to the public. They also test, and that again was around about the same price, between the £30 and £40. Right, sorry, dogs have been barking, so just interrupted there. So yes, when it comes to calcium, I'm not convinced. I read a report suggesting that you can gauge serum calcium, which is our blood levels of calcium, and how it relates to our bone calcium. I'm not sure whether there's been sufficient evidence of that at this stage. So I'm open-minded, but I'm still not sure at this stage. So I don't think it's worth testing calcium levels in the blood. It possibly doesn't indicate the amount of calcium in the bone. And we use calcium throughout the body. It helps with muscle contraction, our heartbeat as well. So it's a very busy mineral, that one. So I don't think that's probably worth testing. Not at this stage. It may be. The correlation between blood levels and bone levels might be satisfactory, but at this stage I've not seen enough. Magnesium. Again, I think so many people in the middle years, women and men, become quite low in magnesium, and I think that's worth finding out what your levels are. And the serum levels of magnesium have been confirmed to be correlated with bone levels. But it's something where it's good to find out what your levels are, and with some professional advice, work out the dosage that's correct to help build it up to the right point. And I'm not suggesting you take these for long term, particularly vitamin D. Hopefully it's just over some winter months, and it's just giving you that boost and get some sunshine when the sun's out. And magnesium, if you get enough sort of foods with magnesium containing foods, then that should be sufficient as well. Quality of the food is relevant here. The quality of the soil is relevant. So a boost every now and then, I think, is good. Full term taking it, possibly not necessary. But it's very individual. Very individual. The other vitamins and minerals, again, I've not found enough to say, yes, it's worth testing on those. So we'll just put those on the shelf. But keep in mind, they are important for bone health as well. It's not all about calcium. It's been shoved down our throats for many, many years that you need good calcium levels for strong bones. Yes, you do, but on its own, it's not actually going to help, you need the other supporting vitamins and minerals as well, so they all work together. So magnesium test, Medichecks, I looked that one up. It comes in at £55 on Medichecks. And I haven't found anyone else who does it actually, but Medichecks is local to me. It could be worth looking at. And then there's testing for what they call biomarkers. So these are markers that show you whether you're losing bone too much or building bone efficiently. And there's one called P1MP. This is procollagen. I've got to look this up. I never remember these names. Procollagen type 1 N-propeptide. And this is the biomarker for bone building. So that can be tested. And we need, for bone building, we do need testosterone and oxytocin. We need good protein, some targeted supplements on occasion, and weight training. We spoke about the importance of weights and stressing the bones last week, yes, and I think that stands out as being very important with bone health. The other biomarker, which is the bone breakdown marker, is CTX. It's C-telopeptide. Now, again in the UK, I haven't seen that this is available independently, privately to you. I think I've seen it as part of a test, a general bone test, but it's possibly something, again, you can get through the GP as part of a overall test. But that's quite interesting as well. And apparently they work in ratios, so as one goes up, the other one will go up a bit, as one goes down, the other one will, and it's just getting them to the right ratio, I think, is the main point there. When it comes to medications, I just want to reiterate, I am not a doctor, but I have come across bisphosphonate on more than one occasion, and it's basically helps the bone stop breaking down. So it sort of halts that breakdown part. And we know that bone needs to build up and break down, and the renewal is what keeps it healthy. With like many things, when it gets old, it becomes brittle. And if we're not replacing bone regularly, we're just keeping it as it is by not breaking it down, it can become brittle. And there is a relationship between this type of medication, biphosphonates, and brittle bones over a number of years. So I think the message here really is being aware, knowing what questions to ask your doctor. Are there alternatives? Is there something else I can take if this doesn't agree with me? And often they do prescribe calcium and vitamin D alongside these medications because there's knock-on effects with certain medications can deplete you of certain minerals. So that's often the case as well. So yes, it does actually send the bone rebuilding through the floor, which isn't ideal, but it can be useful, and it depends where you are, whether you've got bone breakage already, and this might be the option for you. So I hope this little bit of information, it's been very brief, but I don't want to overload you. I would like it to give you enough to be able to say what's right for me, and to be able to ask your doctor, your health professional, questions to inform you. Knowing what to ask is often really important, and always asking what other options are there. And I think often a good question to ask a medical practitioner, because they are very restricted on what they can talk about, believe it or not. They do want to do their best for you, and sometimes they're restricted with certain rules and regs. But always ask them, what would you advise your mother to do? That's quite a good one. Or your wife or your husband, or whatever it might be about. So yes, I hope to continue and show you a video of the REM scan at some point, but otherwise that might be a week or two before I can get that sorted. But thank you for joining me today, and wishing you well, and hope to see you soon. From Molly and Luna and myself. If you like the video, please share it with somebody who might benefit, and like and subscribe if you wish to. Thank you. Bye bye.